When is jaw surgery indicated?
So depending on what kind of the jaw surgery you're talking about. So from from the question that was submitted right here, I'm assuming they're asking about the jaw surgery, which is indicated for teeth, the patients with either we call it as a malpositioning of the teeth. Sometimes when patients have severe malpositioning of the teeth, for example, the teeth on the usually whenever you have the top and the bottom teeth, you have the top teeth sitting outside, and then you have the bottom teeth sitting inside, slightly touching each other.
Right.
Sometimes when you have problems with teeth kind of slightly protruding, the top teeth like this, or the bottom teeth slightly protruding like that. So when you have that, it is possible then you're able to get braces, and then you're able to push them back together. And then, for example, if the top teeth are like this, you're able to get braces, and then you're able to bring them into position. But what happens is sometimes where you have severe malpositioning of the teeth, either the top jaw is right here and then the bottom is right here. So it is because of the way that your jawbone grows.
Right.
So whenever you had it's the growth pattern itself is affected. So you cannot change the position of the teeth much when they are like far apart like that. So whenever they're like this, either the top one, the jaw needs to have some kind of a surgery to bring it back, or the bottom jaw you need to have some surgery to bring this forward, or if you cannot bring it so much forward, or if you cannot bring this so much backward, so you need to have surgery on the top as well as on the bottom to kind of position them equally, close enough. So that's what jaw surgery is about. So if you have questions about whether you're going to need jaw surgery or not, my recommendation is you have a conversation with your dentist. More than likely, if you are not a good candidate for braces, or even if you are a candidate for braces, your dentist either may be choosing to do the braces or they may be referring you to an orthodontist. And when you go see the orthodontist will be able to explain what your options are, whether you are a candidate for braces, whether your condition can be corrected just with braces, or your condition may need a combination of braces and surgery, or he or she may be sending you straight into a surgery. So again, the answer is yes, that's what is jaw surgery. That is because of the either severe malpositioning of the teeth or severe malpositioning of the jaw bones, and it's usually because of the growth pattern, the way that you follow, the way your genes were kind of programmed, the way your jaw bones grew at the time you grew.